given by Dr. Marston Linehan, the Chief of Urologic Oncology at the National Cancer Institute. He states HLRCC is one of the most malignant types of kidney cancer. It needs to be detected because it can spread early and
be lethal.
Just restart. In a speech given by Dr. Marston Linehan, the Chief of Urologic Oncology at the National Cancer Institute, he states HLRCC is one of the most malignant types of kidney cancer. It needs to be detected because it can spread early and be lethal. According to the June 2014 article in the International Journal of Nephrology and Renovascular Disease, entitled Hereditary Leiomyomatosis and Renal Cell Carcinoma, it defines HLRCC as an autosomal dominant hereditary syndrome that causes cutaneous leiomyomas, uterine fibroids, and kidney cancer. Hereditary leiomyomatosis, renal cell carcinoma, is a very rare genetic syndrome that is almost always fatal to the patients who get kidney cancer. HLRCC has 3 types of clinical manifestations, a genetic basis, and treatment options that are limited. HLRCC includes 3 different clinical manifestations, and a patient may exhibit any or all of these. Cutaneous leiomyomas. 76 to 100% of patients have these benign smooth muscle tumors. Uterine fibroids. Almost all women with skin leiomyomas develop uterine fibroids. According to the July 2003 article in the American Journal of Human Genetics entitled Mutations in the Fumarate Hydratase Gene Cause Hereditary Leiomyomatosis and Renal Cell Cancer in Families in North America, 57% of females with skin lesions had to have hysterectomies at or before the age of 30. Kidney cancer is almost always fatal if it gets outside of the kidney. Detection is difficult because the symptoms don't show until the tumor is large or usually metastasized. Now that I have discussed the clinical manifestations of HLRCC, I will now explain the genetic basis. According to the June 2014 article in the International Journal of Nephrology and Renovascular Disease entitled Hereditary Leiomyomatosis and Renal Cell Carcinoma, HLRCC is an autosomal dominant hereditary syndrome caused by germline mutations in the fumarate hydratase gene. Each child born to an affected parent has a 50% chance of developing the mutation. Genetic testing needs to begin in affected families at the age of 8 to 10. It is very rare because there are approximately 1,500 patients worldwide with HLRCC. It is very rare because the world population is 7.3 billion people, and only 200 plus families have been identified. 10 to 16% of these patients develop kidney cancer, and 99% of those are fatal. I have given you information on the genetic component of HLRCC, and finally I will discuss the treatment options for patients with this disease. Treatment options for HLRCC patients are limited due to the aggressive nature of the disease. Skin leiomyomas are very painful. Single lesions may be removed surgically. Multiple lesions may be treated with cryotherapy, electrocoagulation, or laser ablation. Uterine fibroids usually occur before the age of 40 and are large and numerous. Most women require a hysterectomy at an early age. As stated in the August 2011 article in the International Journal of Surgical Oncology, Familial Renal Cancer, Molecular Genetics and Surgical Management, kidney tumors are aggressive and usually metastasize. Surgical removal is the best choice. Metastatic cancer does not respond to conventional therapy. Clinical trials are being evaluated for targeted therapeutic drugs. HLRCC is a very rare genetic disorder that does not have a very high survival rate. HLRCC is the most lethal type of kidney cancer due to its limited treatment options, genetic basis, and the clinical manifestations. On a personal note, my father, Daniel Dimmitt, died of HLRCC on September 10th, 2006, at the age of 37. My sister Maddie and myself were both gene tested, and I am negative, but my sister is positive.